Hello, welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio is Dr. Indra Cidambi, a leading addiction expert and medical director at New Jersey's first licensed outpatient substance abuse detox facility known as the Center for Network Therapy. She has more than a decade of experience in addiction medicine. Dr. Cidambi has in-depth knowledge and vast experience in addictive substances, treatment, and rehabilitation. How are you doing today, Dr. Cidambi?
Thank you, Neal. Doing pretty good.
Thank you. As an addiction expert, there are many different types of approaches to rehabilitation. The Center for Network Therapy, is this your own type of addiction therapy program?
Yes. I kind of coined this kind of an ambulatory detox because one size does not fit all for addiction treatment.
Mm-hmm.
Many patients, when they are confronted about their addiction, like the abuse of substances, the initial reaction will be to kind of, deny it. And they would say, I didn't do it, or, want to escape from this situation. So they don't want to, the fear of going away, going for an inpatient treatment is a huge thing. And so the intervention takes place among the family members with the professionals to kind of talk them into going for treatment, getting the right step into treatment. But now that we have this ambulatory detox, it's less threatening to a patient.
Mm-hmm.
It doesn't mean like all patients can start with ambulatory detox. At least approximately, I would say 50% of the opiate addicted population can really benefit from ambulatory detox. That means a lot. Too many patients who can get.
Are we talking about just opioid addiction or addiction across the board?
Just opioid addiction in general, but more so with opioid addiction. You see younger population and, these 19 to less than 30 years of age, they don't want to go get locked up in a facility in a structured environment. They are afraid to leave their own house and then go away.
Mm-hmm.
So when you present them with this ambulatory detox, they do kind of reluctantly agree to try that. But then that also gives them the stepping stone for them to look into treatment in general. And we can also teach them that if you fail ambulatory detox, the next step is for you to go to inpatient.
Right.
So that way they feel the autonomy. They don't think that you're pushing them right away. I have no choice. So it's less threatening. And, as I said, 50% of the population can really benefit from this level of care. And then they might not even go into inpatient.
Now,
there won't be any necessity.
What sets 150% away from the other?
Like 50%, meaning, I have been running this ambulatory detox for the past 2 months, less than 3 years. So It's kind of awkward. It's more than 2.5 years. So from my experience here, I have come to see that many patients with all kind of addiction, we detox opiates, alcohol, and benzodiazepines. And when we see that, not all of them who qualifies to be, who don't meet the criteria to be at an ambulatory detox level of care, meaning they should have some support at home when they go back home, and they should be able to come back every day. So there should be someone who should be driving them. If they are coming off of alcohol, they can be driving back home. So you do need some family support. Mm-hmm. So once they meet those criteria, they shouldn't be having any psychiatric active illnesses, like meaning they're hearing voices, they're suicidal, then they qualify to go inpatient. Or they don't have any debilitating medical issues, So those kind of patients do come in and they do pretty well because we are cleaning these addiction, in the same environment from where the problem started.
Mm.
What I mean by that, if you take a patient and put them inpatient, they feel very good because they have been isolated from the stressors. Like the drug dealer is not calling them in there. The parents are not aggravating them and, all the problems that they have. But then here they have to go home, face everything, and they might have a relapse, and the next day they bring in the family members and we, deal with it right then and right there and teach them how to survive in their own environment. Because after all, people, places, and person, they cannot run away from their living condition.
Do you help family members to be that support? Because many family members, they're pulling their hair out. They have no idea what to do. Do you have programs specifically for the family member of the addicted person?
Yes, when they come to my center, number one issue is in addiction. It's a voluntary treatment. In many inpatient settings, the patient might say, I'm not giving you permission to call any of the family members. That's the HIPAA we are talking about. But when they say that to me, immediately I tell them, your mom or dad is sitting in the waiting room. I do want a release for them, because if you want to be at this level of care, I need a family member to be involved in your treatment. That kind of gets you a good amount of success. The reason being that when the patient does not want to talk about their relapse, when they are not willing to come back the next day, family is helping the treaters to get them back on track. So it's very interesting to see how addiction is a family illness. Either because of the chaotic family, the patient is addicted to drugs, or because of the patient's drug addiction, the family is now become a chaotic one. So it does benefit both family and the patient being together, working the steps and getting, marching towards sobriety.
Where can we get more information about the Center for Network Therapy?
We have a website that they can go to, which is recoverycnt.com. And that kind of gives you quite a bit of information about what we do, which is an ambulatory detox and the PHP level of care. And, what is interesting about our center is that we accept all private insurances. We are in network with majority of the insurance companies. And also there is next to zero, absolutely not even one patient has been denied of their services at this level of care, because it is half or even less than half of our inpatient expenses that they have to bear. So insurance company really does meet the criteria for ambulatory detox for majority of the patients. So it is very helpful. And also they can call the center itself, 732-560-1080, and we are open 7 days a week. It doesn't matter whether it snows or it is Christmas Eve or New Year's Eve. We are open 360 days. So from 9 a.m. to 7 p.m. And after that, there is an answering service, and we will get back to them. So they can easily, there is no waiting period to come in for an intake. They can call the same day, they can come in, and they will get medicated. We have nurses waiting to serve them. So it kind of helps the patient who is in withdrawal, who wants an attention right away.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Indra Cidambi, recognized as a leading expert and pioneer in the field of addiction medicine. She founded the Center for Network Therapy, and she currently serves as its medical director. And she's been in studio this afternoon talking with us about ambulatory detox, how it differs from traditional detox, and what type of addict would benefit from this type of detoxification. It's been great having you here with us today, Dr. Cidambi.
Thank you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au, and you can subscribe to our podcast on iTunes, also available at hpr.fm.